Topping news, a surge in COVID-19 cases in the country is impacting the healthcare system, with scores of healthcare workers not currently on the job. This as new COVID-19 infections more than twice in the last week shattered the Christmas Day record of 330 cases in one day. Cleopatra Murphy leads us off tonight.
At least 130 healthcare workers are now out of the system due to COVID-19, at least 100 on New Providence and approximately 30 on Grand Bahama. Minister of Health and Wellness, the Honorable Dr. Michael Darville, acknowledged the shortage in staff is causing some strain at the Princess Margaret Hospital, while denying that patients in the accident and emergency department do not have access to care as a result.
We do admit that some of our staff is out as a result of exposure to COVID, whether it's isolation or quarantine, but we are able to provide the essential services. At our legacy unit, we have admissions, and we're opening up more of the tents, but I must admit that due to the exposure of some of our staff members, some of the essential services had to be cut back, and even though we have sufficient bed space, we are now restructuring to ensure that we find the staff where individuals who will be admitted will be able to go in those particular wards.
This comes as the country experiences a continued surge in COVID-19 cases, reporting 1,535 cases between Thursday and Sunday. Thursday saw 520 confirmed cases, 289 on Friday, 249 on Saturday, and 477 on Sunday. Following the New Year's Day holiday weekend, the Minister of Health says officials are concerned about a sustained surge following a number of events that can be seen as super spreaders.
We are watching the amount of cases, and we have been doing an excessive amount of testing. What is concerning us is the percentage of testing is proving to be higher than we anticipate, which is an indication that the disease burden is relatively high in the country. And we are now preparing ourselves to ensure that we have adequate healthcare protocols in place so that if there is a surge that possibly could take place with hospital admissions, we are in a better position to deal with it.
COVID-19 hospitalizations are once again on the rise, with Dr. Darville sharing 55 patients are in hospital with the virus.
Of the 55, it's difficult to differentiate those who may be COVID positive with symptoms from COVID, or whether or not they are COVID positive with other complications in hospital. It's a cross-section, and we're trying to get the exact number.
Darville also defended against criticism that government is not doing enough to contain the virus's spread. He insists government is doing all it can, but the Omicron variant is challenging countries globally.
It's very important that the Bahamian people realize that they have a part to play. We must execute the proper protocols and ensure that we wear our masks when we're in public places, and we are able to go from place to place, minimizing our contact with individuals. It is a challenge. We will definitely be untrue to say it's not a challenge. And what we're experiencing, every country around the globe is experiencing these amount of cases because the virus is so transmissible and very infectious. And as a result of public gatherings in private places, everyone is susceptible. Even where we are right now in close proximity, we are susceptible, even with utilizing the proper protocols.
Cleopatra Murphy, ZNS Network News.